The assisting nurse then drapes a sterile cloth across the patient's body. The equipment which is to be used in the treatment is then made ready. Single procedure. A guiding catheter for the coronary artery. A thin flexible guide wire. A balloon catheter. A balloon catheter with a stainless steel balloon with a liquid at high pressure. The femoral artery area located in the groin. The patient may feel a stinging sensation, but once the medication takes effect, the patient should only feel a dull pressure where the physician is working. A 1 to 2 millimeter incision is then made in the skin to allow room for the catheter. A cannula is inserted into the artery. The flexible guide wire is then fed through the cannula. The cannula is taken out with the guide wire remaining in the artery. The plastic tube is now inserted over the guide wire. Through the tube, the doctor now runs a guiding catheter up to one of the coronary arteries. Balloon inflation inside a vessel narrowed by atherosclerotic plaque creates a wound to the vessel wall, the case on a side branch of the left coronary artery. The images of the coronary artery with the stricture can be seen on a monitor and used as working images during the possibility of watching these images. The doctor now prepares the thin and flexible guide wire, which is to be fed through the catheter and into the coronary artery. The guide wire is fed into the catheter, and it can be seen here that the wire is fed all the way out into the coronary artery through the location of the stricture. The guide wire serves as a guide for the balloon catheter used to expand the stricture. PTCA catheter, a very thin tube equipped with marker bands and a balloon mounted on its distal end, is slipped over the outer exposed end of the wire and inserted on the guide catheter. The balloon is 10 to 30 millimeters long and 1.5 to 4 millimeters wide, and has been specially chosen by the doctor as it best suits the diameter and length of the narrowed treated. Each balloon is made of special materials that allow it to inflate to a specific size. By monitoring the procedure on the monitor, the doctor positions the radioplaque marker band. The marker bands indicate where the otherwise invisible balloon is precise. The balloon is then inflated with a special device operated by the doctor. The inflation pressure varies between 2 to 20 atmospheres. Here the balloon can be seen during its expansion. The duration of a single inflation may take from a few seconds to 2 minutes. It is important for the patient to inform the doctor if he or she experiences any chest pain. The balloon is then emptied and withdrawn. Sometimes it may be necessary to implant a stainless steel prosthesis called a stent, for example if the vessel does not respond properly to balloon inflations alone and remains narrowed. A contrast medium is now injected into the coronary to expand the coronary artery with the balloon alone. In other cases, such as this one, it is necessary to insert a stent at the location of the stricture. A balloon catheter with a stent mounted on the outside of the empty balloon is now fed over the thin guide wire and into the catheter and up to the heart. The balloon catheter with stent is fed out to the location of the stricture. The balloon is then pumped up, causing the stent to press outwards against the vascular wall. Emptied and withdrawn, the expanded stent remains in the coronary artery at the prior location of the stricture. As can be seen here, there is no longer any constriction after the insertion of the stent. The blood flow is restored and the distal heart muscle, depending on the diseased artery, is again receiving a normal amount of oxygen and nutrients. The PTCA procedure takes approximately 1 to 2 hours, depending upon how many blockages are being opened and how complex. The patient must then remain in bed, lying flat, for at least 6 hours, to prevent bleeding complications at the site of the arterial puncture. After 2 to 6 hours,